Thank you very much. It's fantastic to be here. I'm sorry I arrived a bit late this evening. I could blame Brexit since it's responsible for most bad things at the moment, but in truth it was the traffic. But better late than never, and I'm absolutely delighted and thrilled to have arrived here in time to see most of that wonderful performance from the Purple Poncho players. You know, we in the world of politics and in the world of policy making, in the world of healthcare, we talk about lots of things like person-centred care, integrated services. We talk about tackling social isolation and increasing access to employment, putting dignity at the heart of social security. And we talk rightly about having an equality and human rights approach to everything. And all of these things are important, but I have to say I've never seen the importance of all of these things expressed as powerfully as all of them just have been by the Purple Poncho players. So thank you to each and every one of you. You're absolutely wonderful. Can I begin by thanking the BMJ and the Institute for Healthcare Improvement for all of the work that has gone into organising this forum. I also want to welcome all of you. It's such an honour to do so, to welcome all of you here to Scotland, and in particular to welcome you to my home city of Glasgow. I hope you enjoy all that our country and the city has to offer you. As you can see, the sun has been shining today in Glasgow. Don't let anybody tell you that the sun doesn't always shine in Glasgow, because it does. But the presence here of more than 3,000 delegates from over 70 different countries underlines the real importance of this event. And it also, I think, reflects the fact that in societies right across the world, healthcare improvement is increasingly and rightly a major priority. And of course that stands to reason. All of us in government and in the healthcare sector face the same challenges of making the best use of often limited resources while enhancing the safety and the quality of patient care. Improvement methodology and developments in data science provide us with many of the tools that we need to meet that challenge. In 2008, when I was Scotland's Health Secretary and Derek Feely of IHI was one of my senior officials at the time, Scotland became the first country in the world to establish a national patient safety programme. It's something we were and continue to be very proud of. And during that process, the contribution made by IHI and its then Chief Executive, Don Berwick, was absolutely invaluable. IHI and its international partners helped to guide our efforts, and it helped us to communicate what we were doing to Scotland's health boards, to professionals, some of whom took some convincing, and to other key groups. Of course, the programme's initial focus was on reducing the rates of mortality and rates of adverse incidents in our hospitals. As with all improvement work, it began with testing changes on a small scale, and then we applied the most successful changes more widely. And all of that has helped us to make quite remarkable progress. Since the programme began, we have seen a 21% reduction in mortality from sepsis. We've seen an 8% reduction in cardiac arrest across the country. And overall, the first phase of the programme saw an 18% reduction in our hospital standardised mortality ratio, and that's been followed by a further drop of nearly 10% since 2014. Now, of course, it's important to say that these improvements are the result of many different contributory factors: increased access to new medicines and treatments, and of course an overall reduction in mortality rates. But there's no doubt at all that the Scottish Patient Safety Programme has played a hugely important role. And that's why, following its success, we've expanded the programme across other care settings. I know that earlier on today, some of you visited NHS Lothian to learn about our work to improve the quality of mental health care. That's another area where we've learned from the expertise of other countries, from the East London Foundation Trust and from Singapore. And again, we're making some real progress. 6 mental health wards across Scotland have reduced rates of self-harm by up to 70%. In addition to mental health, the Scottish Patient Safety Programme now also covers areas like paediatrics, primary care, neonatology and maternity care. And it's perhaps worth taking the example of maternity care in particular, because we now focus much more on educating expectant mothers about the dangers of smoking during pregnancy, about the need to monitor fetal movements. And these efforts have contributed to a 22.5% reduction in stillbirths since 2013. Now, we know, of course, that it is impossible to be absolutely certain about these things, but I think it seems very likely, looking at the statistics, that the programme has helped to save the lives of more than 70 babies in Scotland since it began, and that is really significant. Of course, in addition to these achievements, the Patient Safety Programme is having a big influence on initiatives which aren't actually part of the programme itself. The Scottish Government now looks to apply improvement methodology in many other parts of our health service. For example, in October last year, I announced that the Scottish Government would invest £850 million over the next 2 years to reduce NHS waiting times. I can confirm today that to guide that investment, we're going to be working with the IHI to establish a new programme of quality improvement. That programme, which will be called Access QI, will look to identify and apply successful strategies from healthcare systems around the world. And we hope that that will then ensure that our additional funding is allocated as effectively as possible, and as a result, it should ensure faster treatment for patients across our country. The final thing I want to say, and the final point I want to stress, is that the impact of improvement methodology, although of crucial importance in our healthcare system, is now going far beyond just our health service. And as a result of that, the skills and the knowledge that we've built up are increasingly being applied in other areas of government. For example, improvement methodology now underpins our Children and Young People Improvement Collaborative, which I know some of you had the opportunity to visit today. The collaborative focuses on improving the services used by children, young people and their families. There are many other examples. We're using improvement now to raise attainment levels in our schools and increase retention rates in our colleges. I can tell you there's even a driver diagram on improving preparation for my weekly session of First Minister's Questions in the Scottish Parliament. But I'll leave it to others to judge whether the quality of the answers has improved as a result. Perhaps we should make the methodology available to the opposition as well to improve the questions, but that would be a partisan point. The point I'm making here, though, is in doing all of this, we are learning from best practice in other countries around the world. And in turn, we are absolutely delighted to see that some of Scotland's work, some of our experiences, is now having a major impact far beyond our shores. The Scottish Patient Safety Programme has inspired similar programmes in other countries like Denmark, England, Norway, Portugal and Singapore. We used to joke in Scotland when Denmark adopted our patient safety programme that we were going to insist on it being called the Scottish Patient Safety Programme in Denmark, but we didn't think we would get away with that. But we are very proud to be part of this movement. We're proud to be learning from others, and we are proud to be contributing our expertise, which of course underlines perhaps the most important point of all. The exchange of knowledge, ideas and best practice is at the very heart of improvement. It's been central to our efforts to enhance the quality and the safety of our healthcare system, and it is something, of course, that is central to this international forum. And my hope indeed my expectation is that proceedings over the next couple of days will lay the groundwork and a very strong foundation for future collaboration and exchange, which I have no doubt will benefit people across Scotland and also right around the world. So thank you all sincerely for being here. We are delighted to have you here. And let me end by wishing you all the very best for a hugely informative and enjoyable event. And I hope you also get the opportunity to see some of our wonderful city. Thank you very much.